Welcome to our outpatient supplemental learning video on medication administration with a continuous ambulatory delivery device, also known as the CADD pump. The purpose of this video is to complement the teaching you receive from your nurse and to act as a resource while at home. The topics we will cover are the function of the buttons of the device, inserting the battery, indicator lights, hand washing, safe preparation of the administration area, priming the line, saline flush, starting the infusion, and troubleshooting.
We will begin by reviewing the function of the buttons on the CADD pump. The start and stop button will start the pump and stop the pump and silence alarms. The lock button is only used by the technician. The question mark is a help key and explains what you see on the screen. The enter button confirms your selection and advances you through all screens. The next button advances you from one screen to another. The dose button is only applicable for patients who are using the pump for pain medications. The options button reviews all program settings. The Y and N buttons allow you to answer yes or no to questions on the pump display. Next, we will review how to insert the battery into the pump. The battery is inserted on the side of the pump. Once inserted correctly, the pump will beep. If it does not, remove the battery, turn it around, and replace it. To begin, thoroughly wash your hands with soap and water for at least 20 seconds, ensuring to use good friction to clean between all fingers and the outside of both thumbs, between your palms and the backs of your hands. Then dry your hands well with a clean towel. Now it is time to safely prepare your administration area. When choosing an area to set up your supplies, ensure that it's an area that is away from traffic, dust, smoke, and pets. Using a clean cloth, wash the surface where you will be setting up your supplies. Once the surface is dry, place a clean towel on the surface. Gather your supplies from the storage area, which should be a clean space out of reach of children or pets, such as an upper cupboard or shelf. You will want to ensure that you have the following supplies: your medication, 2 saline flushes, alcohol swabs, your pump and tubing, and your OPT chart, and a garbage can. Before proceeding, ensure that the label on the medication has your name with the right drug and the right directions. To prepare the pump for medication administration, remove the tubing from the package. Attach the cassette hooks to the hinge pins on the pump. The cassette should fit easily into place and only inserts one way. Place the pump upright on a firm, flat surface and press down so the cassette fits tightly. Insert a coin into the latching button, push in, and turn counterclockwise until the mark on the latch lines up with the solid dot. To thread the tubing into the air detector, remove the paper from the tubing. Open the air detector door and thread the tubing through the groove. Close the door, making sure not to pinch the tubing. Place the mini bag in your non-dominant hand and use your dominant hand to remove the blue plastic cap and discard it. With your dominant hand, pick up the tubing and place between the fingers of your non-dominant hand and remove the protective cap from the spike. Hold the end of the mini bag firmly with the fingers of your non-dominant hand and use your dominant hand to insert the spike into the mini bag firmly but carefully using a clockwise motion. If at any time during this process you touch the end of the spike or the bag, use an alcohol swab to clean the area for 10 seconds prior to continuing. You are now ready to prime the tubing. The screen will say Admin Latched Upstream Sensor On. Hit the next button to continue. The next screen will say Prime Tubing, Y or N. Hit Y for yes. Press and hold the Y button while priming. Continue priming until the line is clear. Once clear, press the N button and you are finished priming. Open both of the saline flush packages and place them on your clean surface. To prepare the syringes, place the syringe in your non-dominant hand and use your dominant hand to remove the cap. Gently pull down on the plunger to break the seal. You will feel resistance. Continue to gently pull down on the plunger until you feel the resistance release. Once the seal is broken, slowly push the plunger up to expel the air. You should see fluid at the tip of the plunger. You may then place the syringe on your clean surface. Repeat this procedure with the second syringe and replace the cap. To prepare your site, pull your protective sleeve up to your shoulder and unroll your extension line. Refer to your purple pamphlet called How to Care for Your Peripherally Inserted Central Catheter and look at your daily checklist to perform an assessment of your IV site. If there are no concerns, then proceed to the next step. If you do have any concerns about your IV site, please refer to your OPT chart to find the appropriate contact information. Hold the end of your infusion device between your thumb and forefinger of your non-dominant hand. Using your dominant hand, clean the end of your infusion device with an alcohol swab for 10 seconds, using good friction around the sides and the top. If at any time you accidentally touch the end of your infusion device or the end of the syringe, clean the area with an alcohol swab before proceeding. With your dominant hand, firmly push the tip of the syringe into the end of the PICC line valve and turn the syringe in a clockwise motion until the connection is tight. Inject the 10 milliliters of saline using a push-pause method. If you meet resistance, reposition your arm and reattempt. If resistance is still met or you experience pain, swelling, or leakage at the IV site, stop, disconnect, and refer to your OPT chart for the appropriate contact number. After you have administered the saline, disconnect the syringe by turning it in a counterclockwise motion and discard the syringe into the garbage. Pick up the medication tubing and remove the cap, ensuring not to touch the end. If you do, clean it with an alcohol swab. Firmly push the end of the tubing into the end of your infusion device while turning in a clockwise motion to tighten. Push the start button to start the pump. Confirm starting the infusion by pushing the Y button when prompted. The pump will then go through self-checks, which you will see on the screen. A screen will appear with the word dosing in a box when the pump is dispensing your dose. Once your infusion is complete, firmly hold the PICC line valve of your infusion device. Using your dominant hand, remove the tubing from your infusion device using a counterclockwise motion and pull straight out. You will now need to administer your second saline flush using the same method as the first flush. Once the saline flush has been completed, neatly coil your extension tubing on your arm, ensuring there are no kinks. Secure the tubing by replacing the protective sleeve. After your medication administration, be sure to document it in your OPT chart on the notes page. If you encounter any issues with the pump alarms, please refer to the troubleshooting sheet called What to Do When the Pump Alarms in your OPT chart. For additional assistance after hours, please contact the 24-hour services number located on your troubleshooting sheet. Discard your used supplies and return your remaining unused supplies to a clean, safe location out of reach of children and pets.
In closing, thank you for taking the time to watch our video, and we hope you have found it helpful in administering your medications at home. If you have any questions at any time regarding your IV site or your medication, please refer to the contact list in your OPT chart.